Hi, I'm Jamie Downs. I'm the medical director for the physician assistant program at Charleston Southern University. I'm also a forensic pathologist, so I see the outcome of COVID infections. Myth number 7, COVID-19 has a 99% survival rate. That is false. The message is misleading. It's a vast oversimplification and really doesn't represent an accurate percentage. The average for the entire country cannot be used to calculate the individual chance of dying from this virus. Think about it, even if 1% do not survive in the US, that's 3.3 million lives lost without vaccine and masks. Let's break it down. The average case fatality rate, or CFR, in the US is actually 1.6%. Now the CFR is exponentially higher in high-risk groups. You know, like your parents, your grandparents, young children, people with disease. In those populations, it can be as high as over 20%. That means 1 out of 5 higher risk patients with COVID will die from the disease. To compare that, 1 out of 2,000 polio cases progressed to paralysis. Now, didn't die, but paralysis. Of the people that progressed to paralysis, only 10% of those cases were fatal. So 1 out of 20,000 with polio, which we eradicated through a vaccine. The COVID Delta variant introduced a much more contagious and dangerous version of the coronavirus. And this one is particularly scary and should be particularly of concern to you because it affects younger and healthier people. Now, we don't have all the answers, but we do know that time and data will tell us what the actual damage will be and is. Instead of percentages, why don't we look at the actual numbers of human beings, people, mothers, fathers, brothers, sisters, children that have been affected. Since COVID hit our country, over 740,000 people have died from COVID-19. In fact, in the state of South Carolina, over 13,000 people have died. That's in our state alone. Now, maybe those numbers don't mean a lot to you, but if you look at every war that's been fought in the U.S. from the Revolution to the present day, 640,000 people died in the Civil War. Roughly 640,000 people died in every other war the U.S. has ever fought. Excluding the Civil War, over 100,000 more people have died from COVID-19 than every war fought in the history of our country. Compare that with something like the flu. 155 people died of the flu last year. COVID is 10 times more lethal than seasonal flu, 30 times more lethal than polio. This myth is a misperception and ignores the fact that many people who survive COVID-19 have long-term complications. For instance, not being able to smell, not being able to taste, not being able to breathe. The people who survive this virus can also spread it to other people who may not be as lucky as they are. Remember, mortality, death, is not the only outcome that matters. Please, get vaccinated, wear a mask, and wash your hands. I do not want you to become one of my patients.